So welcome, and thank you all very much for coming along this evening to our hybrid event where we're navigating both Zoom and in person. I'm Susie Parker. I'm the research fellow here at UQ Centre for Clinical Research, and also the Deputy Director of the CRE Respond, which is our Centre of Research Excellence based here at UQ-CCR. Under the lead of Jason Roberts. And this event this evening, centred around microsampling for infectious diseases, is part of our educational program, which we've been running for over 5 years now. And the event is recorded, and you'll find it on our YouTube channel amongst many other historic presentations, and we're running about 9 this year, and so this is just one of those. And to start, I'd just like to do an acknowledgement of country. So the University of Queensland acknowledges the traditional owners and their custodianship of the lands on which we meet. And here today, we are on Turrbal and Yagara land. And I was learning just recently that the Turrbal people would meet at the Old Queensland Museum, which is just a few hundred metres from where we are now. I think that's a nice tie-in where they would meet and share knowledge, and that was part of their education. And indeed, this is part of our education program. We pay our respects to their ancestors and their descendants, who continue cultural and spiritual connections to country. We recognise their valuable contributions to Australian and global society. Sorry, just trying to navigate the slides. Okay. This evening, this event, as I mentioned, is part of our ongoing education program, and we do invite feedback. We'd love to hear what you felt about this evening, what you would like to see in our program, if there's particular events you'd be interested in us running. So we will contact you, and if you could provide us with some information on the event, we'd love to hear from you. I would like to also acknowledge our sponsors for the event, including CHU Nîmes, which is a hospital university in Nîmes in France. They have a strong educational research, which we have in partnership with the CRE. And also our other partners, Pfizer, Gilead, Baxter, and MSD. And I'd like to now introduce to you the co-chair for this evening, Professor Jan-Willem Alffenaar, who's flown in from Sydney to join us, and he'll talk about our partnership with IATDMCT.
Thank you, Susie. Yeah, it's lovely to be here in Queensland after attending several sessions of this wonderful symposium online. So finally being here live is really good. So yes, the collaboration with IATDMCT is something that has been introduced a little while ago, where there was interest to have joint regional educational seminars. And one of the people really encouraging this is Debbie Marriott, working at St. Vincent Hospital, to all involved in TDM well known. And this session today about microsampling is in collaboration with the Alternative Sampling Strategies Committee of IATDMCT. And that group really tries to encourage and research different microsampling techniques, as well as the use as alternative matrices. So that comes back to what IATDMCT is. It's a multidisciplinary society consisting of lab scientists, physicians, pharmacists, pharmacologists, trying to optimize and to research all types of techniques involving sample analysis in not only TDM, but also toxicology, and trying to provide better care for patients. I think we can go through the program of this evening. Let's scroll. Yes. So we've had the welcome and introduction, and I will continue with our first speaker, Katie Longman. She's going to talk about improving drug analysis from a single finger prick. Afterwards, we will move on to Stef Schouwenburg and Soma Bami from Erasmus University in the Netherlands, and they have their perspective on microsampling. Then we will move to Professor Lawrence Manning of the University of Western Australia in Perth, talking about better penicillins, better hearts, rethinking long-acting penicillins for rheumatoid heart disease. Then we will move to Sydney, to Sophie Stocker, the use of biosensors for in situ measurements of antimicrobials. Then Susie Parker will tell us about microsampling of antimicrobials to support PK studies in pediatric patients. I will talk about the future perspective of TDM in the community. And last but not least, we will move to Prakruti Rao from University of Virginia, and she will talk about urine analysis with a smartphone to facilitate TDM in a remote setting. So you can see at the program that we will take the questions and answers at the end of this evening to make sure that we are able to keep everything on track. So without further ado, I will introduce my co-chair, Susie Parker. She's from University of Queensland and Centre for Clinical Research Excellence. And she's a research fellow and deputy director, as she already mentioned, of the CRE Respond at UQ Centre for Clinical Research. And her research is principally focused on establishing evidence base for effective dosing. Dr. Parker's content knowledge, skills, and expertise played an integral role in ensuring quality sample collection, innovation in methodology and technology, adaptation through the application of microsampling. But now I think we go to the first speaker. Yes, that would be great. Thank you.
So we have a few introductions to go through. To formally introduce our co-chair, Professor Jan-Willem Alffenaar. Oh, I'll be reading from here. Professor Alffenaar is Chair of Clinical Pharmacy at the University of Sydney. His research interests include investigating the use of anti-TB drugs, as well as the clinical application of therapeutic drug monitoring. He has developed implementation strategies for TDM in different settings, including programmatic treatment, making best use of available analytical techniques and a patient-targeted approach. And I'll pass back to Professor Alffenaar to introduce our first speaker.